One of the most common conditions I treat is arthritis. Arthritis is a term referring to pain and inflammation in any joint of our body, resulting from damage or destruction to the smooth gliding surface of the joint, known as cartilage. Ankle arthritis is a common source of ankle pain that occurs frequently after trauma or as a result of an underlying inflammatory condition such as rheumatoid arthritis. Operative treatment is generally considered for patients with persistent symptoms that fail to respond to appropriate non-surgical measures, including pain medications such as NSAIDs, bracing, physical therapy, and injections. Once we develop bone-on-bone arthritis, our main two options include ankle fusion and ankle replacement. In ankle fusion, or arthritis, we're essentially fooling the body into thinking that the separate bones of the ankle belong to one another, and in doing so, we remove the painful grinding motion. Traditionally, fusion was the favored treatment for end-stage ankle arthritis, and I still believe it's the best option for many patients. However, there are concerns that the restricted motion following arthritis increases the stresses on the surrounding joints, leading to further arthritic change. The preserved motion of total ankle replacement may be protective against further degeneration while providing equivalent pain relief. The concept is the same as hip and knee arthroplasty. We remove the bad bone and cartilage, and we replace it with metal and plastic components. Over the past decade, total ankle replacement surgery has evolved as an alternative to ankle fusion in select patients with ankle arthritis. These include adult patients with primary, post-traumatic, and inflammatory arthritis who have significant pain, loss of mobility, and loss of function of the ankle. Patients with previous hindfoot fusion or significant arthritic change in the neighboring joints are also considered good candidates for the replacement. Careful evaluation is critical when selecting patients for a total ankle replacement. Age, cause of the arthritis, deformity, instability, ankle motion, and adjacent joint arthritis. These are all major considerations when selecting the appropriate procedure. Ultimately, I have to factor all these components into the decision-making in order to achieve the best results for my patient.